Welcome to Concentra. Concentra has over 30 years experience in the occupational medicine field. We're a national company. We have over 600 clinics. We have also included in that are the work sites that we have. Locally in Arkansas, we have a location in Little Rock that's at 101 Mableville Plaza. The clinic hours there are Monday through Friday, 8 to 5. Then the location in North Little Rock is 3470 Landers Road. And the clinic hours there are Monday through Friday, 7 to 6, and Saturday, 9 to 1. We are the nation's leading provider in the occupational medical field. We provide all types of medical service that any employer would need for their patients, whether it's providing DOT physicals, respirator physicals, asbestos physicals, drug screens, breath alcohol. We can provide all those in one location. The care that we provide in our facility is to maximize productivity back at the workplace while cutting back on work comp costs. And we do this by providing 4 main keys. By using employer engagement, by meaning that when we meet with an employer, we want to make sure that we have a set protocol in place. So when the employer sends its employees here, there's already a set protocol in place for all the services that they want, as well as a communication plan. Secondly, we have what we call patient engagement, which we want to make sure when their employee does encounter our clinic, that they come into a warm, welcoming environment, that it's not a cold, take a number type environment. So we want them to come in, feel warm welcome, that they feel like their needs are being met, that the staff feels caring and are listening to their needs. Also, we wanted to make sure that the employer knows that when the employee comes here, it's a one-stop shop, so that their employee can get everything that they need done here, whether it's the drug screens, the breath alcohol, any type of component they would need for their physical. All medical services can be done in one location. And then thirdly, communication, that's a huge part of it. We want to make sure that anything that that employer would need from us, we get that on the front end. That is also set up in their protocols. When their patient comes in with an injury, after that initial visit, our doctor will call them, let them know what the care plan is for their employee. And if the employer has any questions at that time, they're allowed to ask the physician so they can clarify anything that they may have the misunderstanding about. We also, at the time of checkout, will send to the employer and to the adjuster information about that employee so that they will know who they saw, who the physician was, what time they came in, what time they left. They're going to know what the restrictions are and any information about that injury. They'll also get checkup information, follow-up, if the patient's referred, if the patient has physical therapy, if the patient misses a visit. All that information is going to be sent to the employer and to the adjuster. Quality medical outcomes. We're very focused on making sure that we're obviously treating the patient with great medical care, but also making sure that we don't do anything unnecessarily to cause a recordability for the company. Our doctors are the experts in the medical field of occupation. So we know how important it is per industry and what each industry is looking for their particular employee. So we know that when their employee comes in, that we have to be very careful about restrictions, about recordables, and how important it is for them to get their employee back to work. So we're very careful of that. While treating their employee, we also keep in mind that we also want to make sure that we get that employee back to work. Each of our clinics, we have physical therapists, we have radiologists, we have RNs, and then we have each location has 2 to 3 physicians located in each location. And the physicians specialize in occupational medicine. We have an affiliation with the St. Vincent's Emergency Room, so if anything happens after hours or when we're closed, and it is a true emergency, they go to St. Vincent's. They can go to the St. Vincent's at Wildwood or the St. Vincent's on University, their ER department. They go to the ER department. We have a coordinator that will go Monday through Friday to the ER department. Anything that was work comp related that goes to the ER, they actually turn it back over to us. So we're able to follow up on all work injury illnesses that went to the ER. Then we get that back into the work comp realm. We call the employer back and we let them know your employee was seen at the ER Sunday morning. We've got them back at Concentra. They do not go back to the ER. They do not go back to a general practice physician. They do come back to us. And then we take care of them, get them back into the work comp, get them seen again, and then get them back into work. Thank you, Sherwood Chamber of Commerce, for making Concentra Business of the Month. So when you have an urgent care need, come see Concentra.